Good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is the medical tidbit of the day. I want to talk about colorectal cancer and why it's an urgent health concern for us. And it is one of the most preventable, yet deadly cancers affecting people worldwide. All right, and among all racial and ethnic groups, that is. But black men and women have the highest incidence and mortality. Okay? And that is despite advances in screening and treatment. This racial gap, persists. And this is really driven by a complex mix of genetics, socioeconomic, and systemic factors. We got to be brutally honest, about this. According to the American Cancer Society, Black Americans are about 20% more likely to be diagnosed with colorectal cancer, and nearly 40% more likely to die from it compared to other racial groups. And the disparity is particularly, stark among younger individuals. There is we have to ring the alarm on this because there's been a rise in colorectal cancer cases under the age of 50, especially in black men, right? The average age of diagnosis in black population is about 5 years younger than in the white population, right? And this underscores the need for earlier screening guidelines and more awareness in our communities, right? Remember, these environmental and social factors, they exist. But let's not forget the genetic aspect of this, right? There's several genes that, especially the APC, that's one of the ones I can think of, that occur frequently in colorectal tumors from black patients, all right? So that's suggesting that there is a biological, effect in colorectal cancer, all right? Now, there is also some evidence that shows that black patients is more likely to develop right-sided colon cancer. And that tends to be more aggressive and more difficult to detect during colonoscopy. So you want a complete colonoscopy. You want to go through the entire rectum, the sigmoid, left colon, transverse colon, down all the way to the right colon, down to the cecum and sylvial, that whole area. Lifestyle, I've emphasized lifestyle, right? Dietary habits, I think, is important. It's been documented that diets high in red and processed meats and low in fiber and fruits and vegetables increases your risk of cancer. It's what our Western diet has become, right? And it's important because when you look at the black community and you think of the food deserts, you see the cheap food is processed foods that's not good for you, right? And with that comes obesity and the lack of physical activity, right? So obesity is a major risk factor for colon cancer, right? So we have to take that into consideration. Alcohol and tobacco use is in there also, okay? And let's talk about the gut microbiome. And what does that mean? That means the bacteria in the gut, the good ones, being suppressed by the bad ones, right? And all this is important in understanding why your diet and your environment can increase inflammation and your carcinogenic exposure in your colon. That's important, all right? So again, the disparity in colorectal cancer is not only genetic. It's systemic racism, it's healthcare inequity, right? Delay or absent screening. Black patients are less likely to be offered a complete colonoscopy. That's not right? Uninsured and underinsured individuals face barriers to preventive care, diagnostic testing, and specialist treatment. And there is this idea that it's not an idea, it's real, the physician bias and the mistrust. If you think of the Tuskegee experiment and the generational mistrust of the healthcare system, there's reason for mistrust, and we as physicians, we have to work on fixing that. Right? Low income and lower education levels correlate with reduced awareness, We have to educate, we have to make people understand. And we need to be serious about screening and prevention, right? We talk about the age of 45, right? You have to be able to say, what, maybe we need to go down to the age of 40 and 35 and know your family history. Get the colonoscopy. Every 5 years, every 10 years, whatever it takes, right? The fecal test. There's a fecal immunochemical test that can be done now. Cologuard can be done every 3 years. Get these things done, and doctors educate your patient and get these things done. Community outreach program, right, tailored to us, has shown to create some success, and we need to pay attention to that. All right? And even after diagnosis, survival differences persist. Black patients are less likely to receive surgery or chemotherapy, right, than the white counterparts. That is wrong. We need to advocate for ourselves. We need to advocate for our patients. We need to stand up, right? So colorectal cancer remains a critical public health crisis in the Black community. And that is important, that we have to drive this home, right? Ultimately, colorectal cancer is largely preventable, and with equitable attention, education, and resources, the lives of countless Black men and women can be saved. Let's pay attention to this, folks. This is important. This is a cry because younger and younger patients, Black men, are dying from colorectal cancer. That's all I have for today. I have to run. Have a great day. Peace.